Hi, I'm happy you're here. My name is Dr. Hamide Farshi. For over 20 years, I've been passionate about my work as a dentist in Hamburg, and I am also a book author and one of the top specialists in Europe for the treatment of temporomandibular joint diseases called craniomandibular dysfunction, or CMD for short. More and more adults today suffer from pain in the mouth, jaw and face area, as well as from headaches, migraines, tinnitus, or severe tension or back problems. However, very few people think of seeing a CMD specialist for these symptoms, but precisely that can be the beginning of a pain-free life. And yes, I know, the medical term for CMD always sounds a bit of a mouthful at first. I suspect that some people have found this a hard nut to crack linguistically. The term comes from the following: cranium meaning skull and mandibular meaning jaw. When we talk about a dysfunction, it means that something is not right, that something is not working properly. This already gives the first indication of the exact definition of craniomandibular dysfunction. But I like to express it a bit more simply. When we talk about CMD, we are talking about a disease that affects the jaw. More precisely, the upper and lower jaw, the jaw joints, and the chewing and neck muscles. Experts also like to talk about a dysfunction of the chewing and jaw system, or a malposition of the jaw joints. However, the most important point is this: if a malposition develops in the jaw area or is already present, for example, if the position of a tooth changes due to grinding or pressing or poorly adapted dentures, then this can really mess up the whole body in a very detrimental way. As I said, my practice sees patients on a daily basis, some of whom have suffered from back, shoulder, neck, muscle, and joint pain for years, as well as migraines, tinnitus, and dizziness. Ear and jaw noises, and even heart and bowel problems are often an issue as well. Most of the people who come to my practice already have a real medical odyssey behind them and an extensive history of many incorrect and false diagnoses, simply because it has never occurred to anyone that the symptoms could also have something to do with the chewing and jaw system. But that is in fact entirely possible. I can even say this from personal experience because I too belong to the club of people affected by CMD. For me, everything started with toothache, which I could not attribute to anything. My face hurt every night and I had muscle pain in places I didn't even know there were muscles. No doctor could help me for a long time until someone discovered CMD and I learned how the interaction between the jaw and the body really works. If you are now thinking that you too could have CMD, I can only tell you it is a real possibility. Almost every other person is affected by CMD, and most suffer from it without knowing. Perhaps not permanently, but from time to time, in other words, at different stages of life. But the good news is, it's possible to treat this. Almost all people affected by CMD can be helped by treatment on the teeth and jaw. However, to determine the condition of your jaw, a dentist has to take a closer look at it. Unfortunately, this isn't possible in every practice today because it requires specially trained CMD experts. As a CMD specialist, I would of course be happy for you to contact me directly with your problems. But you can also take a look at my new book, The Jaw Code. It will tell you everything you need to know about craniomandibular dysfunction, how to recognize it, and what exercises can help you in addition to CMD therapy.